Hi everyone, welcome back to my channel and thanks for stopping by. And today I wanted to answer a question that was posted in the comments section a few days ago, and I tried to, and again, please, if you have questions, please leave them below in the comments, and I'll do my best to answer them. If I'm not clear, ask them again or ask them a different way, and I'll be glad to do another video because often, if you have a question, so does many of the other people that will be viewing this video either now or in the future. But the question posed was, what repetition ranges should you train in as far as resistance training, strength training, and then of course what associated weight or load. So obviously if you train with a lighter resistance or weight, then you're capable of doing more repetitions, right? So in other words, if a person's maximal strength on a bench press or a chest press is 100 pounds, that means they can only do 100 pounds once. So that would be at 100% of their max or 100% of their one repetition max. Versus if they could do 50 pounds, that would be at about 50% of their 1 RM. And I mean, we could actually have someone do that, but at around 50% of their 1 RM on a chest press exercise, they could probably get, I don't know, maybe over 20 repetitions. So the question was, how should I train? What are the most productive ways to train from a standpoint of how many repetitions per set, and then what associated load or resistance would be most appropriate or most effective? And the answer to that question is all of them work. Honestly, all of them work. I think one really good piece of advice to give to people is, if you're orthopedically sound through all the major muscle groups of the body, you're probably going to get your greatest strength gains and body composition changes in a rep zone where you're reaching fatigue per set anywhere, and this is broad range, please bear with me, from around 6 reps to around 20 repetitions. That is a very large range. Okay, I get that. That means, at a 6, where you can just complete 6 reps per set, depending on the exercise, you're probably using greater than 85% of your 1 RM, depending on the exercise, 1 repetition max. So about 85% of what you could do one time. Whereas if you did 20 reps and you reached fatigue or failure at a 20 RM, you're probably exercising with around 50 to 60% of your 1 RM. Now that depends on the individual and a lot of factors, probably outside the scope of what we need to cover in this video. But for the most part, if you're in the beginning stages of a training program, I think anywhere from 6 to 12 to 15 is probably a good, safe range to follow. So the key to this is, and it's like I mentioned the other day, is to record the weight and the repetitions that you completed at a given load, or have some way of knowing where you're at, and then being progressive, either adding an increase in the weight done. So it's like back to the chest press example. If you're doing chest presses and you do 100 pounds for 12 reps, and you want to keep your rep zone between 6 to 12 reps, and once you can get to 12 reps, you would want to increase the load by maybe 3 to 5%. So then you might go to 105 pounds or 110 pounds. That would be if you could get 12 reps, and then that might drop your reps completed per set down to 7 or 8, and then you could gradually over the weeks try to get up to where you're doing the 12 reps, at the heavier load, whether it be 105 or 110 pounds. And once you've completed the 12 reps, then you could add another 5%, 3 to 5%, and then increase until you reach 12 reps again. Now you could do that at any rep zone. Okay, so like you could, for lower body, a lot of times we tend to use a little bit higher reps. It depends on the individual and their orthopedic status. But if you were in, say, the 10 to 20 rep zone on a leg press, you could have, say, I don't know, 200 pounds on the leg press, and the first week you completed, a set for 12 repetitions. Then the next week you got 18 repetitions. Then the third week, with that same 200 pounds, you completed 20 repetitions. Then you could add resistance to that, and then again, your reps completed would decrease because you're adding resistance. So that's a pretty linear way to demonstrate progression. And so I think the key here is to sort of pick a rep zone that you know is safe for you, and be progressive there. And another issue with choosing rep ranges is orthopedic status. So, for instance, if a client has some degenerative changes in a joint, like a knee or even a shoulder, they're not going to be able to train, at 85% of their 1RM at least, and not experience perhaps some joint discomfort. So in that case, we might just choose to be in at least the training for that particular muscle group. We may choose to have them train lighter and progress in that lighter loading and higher rep zone. Therefore, they're not exposing their joints to as much force and stresses. That's just what I found works best, because we always kind of really let pain be our guide. So, for instance, if someone has, a knee issue, or perhaps, some sort of arthritis or something in their knee joint, or some sort of pain, and they could even train at the 20 to 30 rep zone, which means they're exercising with a load that might be like at 50% of their 1RM. And then they start off week one, they've done 20, with that particular load, say it's 200 pounds again, they completed 20. And then maybe the next week they did 22, then the next week they did 26, and then they finally reach their 30 reps with that first week's load of 200 pounds. So they've actually increased the reps by 10 repetitions with that particular load. Okay, so that's a 50% improvement in performance at a given load. So if they were doing 200 pounds, they started at 20, ended up doing 30, actually that'd be about a 30% improvement in volume at that load. And then they could actually increase the resistance maybe 10 pounds, and then gradually build up to that 30 reps per set. Okay, so really I find in all of these years of training clients, myself included, is really the person's orthopedic status and how an exercise feels across their joints really will determine whether or not they can train at those higher percent of 1 rep maxes and progress in that lower rep zone, versus training lighter and progressing there. Okay, so the real key is working hard and then being progressive in either rep zone. Now, I think we do have to be very careful here, and if someone is sound, they don't have a lot of any joint discomfort, and they can train at a heavier load at lower repetitions, and they're just beginning exercise, then really they should probably do that, because you are going to improve in strength much more rapidly, especially during those early weeks and months of training. Okay, so this is not a license to train light and just do bunches of reps, but I think it's just being prudent with your training and practical. Okay, so I train a lot of aging individuals, or people, certainly over the age of 50, who have some wear and tear issues, and we just need to train lighter and be progressive in that lighter resistance and higher repetition ranges. And one more element, and look, every one of these really acute training variables that we could discuss, and we should spend time discussing all of them: exercise selection, rep ranges, loading, rest interval, frequency, volume, all of those things we need to discuss here, and we will over the coming weeks. But all of them are really individual specific, so each individual should have sort of a tailored program to meet their status for their health, orthopedic status, the way they move. But as a person advances, also, like in my position, I've been strength training consistently for 35 years. I have to vary my training now. So one week I might train heavier, and then the next week I may train a much lighter load. So for instance, week one on a chest press exercise, I may do 6 to 8 repetitions per set and 2 or 3 sets of that. And then the next week I may do 20 to 30. And then I may go back to doing the third week back to the 6 to 8 repetitions, and then the fourth week back to a higher rep range, and then alter my chest pressing exercises. That's a way to do it. That's sort of a kind of a non-linear way to strength train. But I don't want to get too complicated here. Look, if you're advanced, you do need to vary your training. There's things that need to be changed. You cannot do the same exercise program from now till till you leave the earth. You have to change things, and the more advanced you get, the more variation that you need, and really the more precise you need to be with your training and tend to some recovery. But anyway, I wanted to talk about rep ranges today and associated loading or resistance. I hope that made sense, but we do need to take the individual in mind as to whether or not we train heavier or lighter. We need to work hard in whatever rep range you choose to work out in, and when you can, especially if you're just beginning exercise and strength training, or you've kind of had a layoff and you're getting back, I do think you're going to get your best improvements in strength and lean tissue mass, probably in that 6 to 12 rep range, and associated load with that, which would be probably anywhere from 80 to 95%. So that's it for this video. I hope that helps. If you have questions, please feel free to leave the comments below, and I'll do a video on it. Talk to you soon.